How do bacteria quickly evolve resistance to UTI antibiotics? Imagine bacteria as tiny, adaptable creatures that can change rapidly to survive threats like antibiotics. When you take antibiotics for a urinary tract infection, these bacteria face a challenge. Some bacteria have clever ways to outsmart these medicines, making treatment more difficult over time. One way bacteria do this is by producing enzymes called beta-lactamases. These enzymes act like molecular scissors that cut up antibiotics such as penicillins and cephalosporins, rendering them useless. Over the years, bacteria have developed many types of these enzymes, including extended-spectrum beta-lactamases and carbamidamases, which can even deactivate powerful last-resort antibiotics. This enzymatic destruction is a major reason why some antibiotics stop working against resistant bacteria. Bacteria can also change the parts of their cells that antibiotics target. For example, they can modify penicillin-binding proteins, which are involved in building their cell walls. When these proteins change shape, antibiotics can't bind effectively, so the bacteria can keep growing despite the medication. Another trick bacteria use is reducing the number of porin channels in their outer membrane. These channels are like doorways that let antibiotics enter the bacteria. When bacteria decrease these channels, less antibiotic gets inside, making it harder for the drug to reach its target. Bacteria are also equipped with efflux pumps, tiny molecular machines that actively push antibiotics out of their cells. This keeps the internal concentration of the drug low, preventing it from doing its job. These pumps can be turned on or off, giving bacteria a flexible defense mechanism. A key factor in the rapid spread of resistance is horizontal gene transfer. Bacteria can share resistance genes with each other through plasmids, transposons, or direct contact. This means a resistant strain in one part of the urinary tract can quickly pass its resistance traits to other bacteria, spreading the problem fast. Some bacteria from biofilms, protective communities encased in a slimy matrix, that shield them from antibiotics and immune defenses. These biofilms make infections stubborn and harder to treat. Capsules, which are protective outer layers, can also help bacteria hide from antibiotics and immune cells. The main driver behind this quick evolution is the use of antibiotics. When antibiotics are overused, misused, or taken incompletely, it creates a strong selective pressure. Only bacteria that can resist survive and multiply, leading to resistant strains that are tougher to treat. In terms of bladder health, resistant bacteria can cause recurrent or persistent infections, which may lead to ongoing inflammation and irritation of the bladder tissue. This can complicate recovery and potentially impact bladder function over time. That's why it's important to use antibiotics responsibly, follow your healthcare provider's guidance, and have susceptibility testing done to choose the right medication. In summary, bacteria develop resistance to urinary tract infection antibiotics through enzyme production, target modification, reducing drug entry, pumping antibiotics out, sharing resistance genes, and forming protective biofilms. Addressing this challenge involves careful antibiotic use, ongoing monitoring of resistance patterns, and personalized treatment plans based on susceptibility testing. Always consult a healthcare professional for the best approach to managing infections and protecting your bladder health.